This next section will cover medication regimens commonly given to patients with heart failure, as well as medications given for angina, which is chest pain, as well as acute coronary syndrome. In this section, we'll discuss medications that are used to treat angina pectoris and congestive heart failure. There are many classes of medications that have been shown to improve outcomes for patients that have congestive heart failure, and they include ACEs and ARBs, cardiac glycosides, diuretics, and beta blockers. Out of these medications, the only two classes that have been shown to improve mortality are ACEs and ARBs, certain diuretics, and beta blockers. We'll start with ACE inhibitors and angiotensin receptor antagonists, or ARBs. These are medications that are considered primary therapy for patients with heart failure. The way they work is by slowing the progression of heart failure and prolonging survival. After myocardial infarction, all patients should be placed on ACEs and ARBs because the way they work is by preventing the remodeling of the heart that's leading to heart failure. And that remodeling includes fibrosis and dilation. Cardiac glycosides, also known as digoxin and digitoxin, are a major class of medications for heart failure. The way these work in heart failure is by blocking the sodium-potassium ATPase. The overall effect of this is to increase intracellular calcium concentrations. This causes positive inotropic effects in the heart. This medication is then able to increase the cardiac output. These medications are also used for atrial fibrillation in that they slow AV nodal conduction and decreases the ventricular rate. Digoxin used to be a first-line medication for heart failure. Now it's third or fourth line. And the reason is that digoxin was not shown to have an actual mortality benefit in patients that have heart failure. Again, the way digoxin works is by binding the sodium-potassium ATPase and inhibiting it. If the pump is disrupted, then the internal sodium concentration increases. This reduces the driving force for calcium efflux of the cell, and then calcium is able to build up intracellularly inside the cell. This causes the sarcoplasmic reticulum to take up more calcium, and this then leads to more calcium available for release by the SR in response to depolarization. So therefore, these patients are able to get more contraction per action potential. Cardiac glycosides do compete with potassium for the extracellular binding sites, that is on the sodium-potassium ATPase. Hyperkalemia then would decrease the effect of the digoxin, because potassium then would get in the way of binding to this ATPase and block digoxin from binding to it and doing its job. Hypokalemia, or low potassium, would increase digoxin's effects and therefore lead to possible toxicities because digoxin would be able to bind all it wanted to the potassium ATPase. Potassium should be kept in the normal range in patients that are taking digoxin in order to prevent these situations. Adverse effects of digoxin are a favorite topic to be tested on step 1. This is a medication that has a narrow therapeutic index. Any patient that's taking digoxin, it's important to measure digoxin levels in the serum regularly. The early signs of toxicity from digoxin can include anorexia and nausea and EKG changes. That can be a shortened QT or T-wave inversions. Later signs of toxicity may include disorientation, visual disturbances, hallucinations, and then life-threatening arrhythmias or tachycardias and AV nodal block. Digoxin is also known to interact with certain medications such as quinidine and furosemide. Quinidine works by decreasing the volume of distribution and the clearance rate of digoxin. Therefore, the concentration can go up of digoxin. Furosemide is known to cause low potassium or hypokalemia. Both of these situations can cause increased toxicity of digoxin. Digoxin is also able to interact with amiodarone, verapamil, and erythromycin. In order to prevent or manage these side effects, it's very important that any arrhythmias be recognized as soon as possible. Also, for these patients, potassium and magnesium levels should be kept in the normal range. If a patient is known to have an elevated digoxin level and they're in a life-threatening situation with regard to arrhythmias or their mental status, these patients can receive DigiFab or DigiBind, which is an antibody fragment that can bind digoxin and remove it from the system. This medication is dosed based on total body burden of digoxin. This is a newer medication and is very expensive. Next, we'll talk about diuretics. The major types of diuretics that are used in hypertension include thiazide and loop diuretics. The way these medications work is by reducing extracellular fluid volume. These are also used for chronic heart failure. Loop diuretics are used for acute heart failure. Beta blockers are also used in heart failure, but again, they must be used with caution. Carvedilol, or Coreg, is particularly effective in heart failure because of its combined beta antagonist properties with alpha-1 adrenergic antagonist properties. The way beta blockers work is by decreasing afterload and decreasing myocardial work, which allows the heart to relax. In a patient in cardiac shock, you should absolutely not use beta blockers. Instead, these patients need beta agonists, and these include dobutamine, dopamine, and isoproterenol. Cardiac shock occurs when heart failure gets so bad that the cardiac output is diminished to the point where organs are not being perfused to the point that they need to be. Dobutamine is an intravenous medication that is commonly given in patients in heart failure who are not responding to the classic therapy. Dobutamine actually increases cardiac output by agonizing at beta-1 receptors, which increases renal perfusion and urine output. The reason this happens is because the cardiac output increases, which causes renal perfusion pressure to increase. The problem with dobutamine is that because it binds to beta-1 receptors, it may actually cause arrhythmias because of increased sympathetic drive. These arrhythmias may include tachycardias. Prolonged use of dobutamine can also increase renin secretion and worsen heart failure. Therefore, these medications are meant for short-term use and sometimes bridged to cardiac transplant. Dopamine is another medication given through the intravenous system. Dopamine at low doses, which include 2 to 3 micrograms per kilogram per minute, work on the D1 receptor in the kidney to increase renal perfusion pressure. This can help in patients that are not diuresing properly on diuretics only. Dopamine at medium doses, approximately 3 to 5 micrograms per kilogram per minute, can actually bind the beta-1 receptor and can increase cardiac output. Higher doses of 5 to 10 mics per kg per minute can activate alpha-1 receptors and cause vasoconstriction. The higher the dose of dopamine, the greater the risk for causing arrhythmias. So as you can see, with dopamine, the higher the dose, also it can. Other treatments for heart failure include VADs, or ventricular assist devices. These are implantable devices that are mechanical that can actually take blood out of the heart and pump it into the peripheral circulation, thereby increasing cardiac output. VADs are generally considered to be a bridge to heart transplant. Certain patients that have heart failure that has gotten so bad that their heart is not able to pump blood to their organs may require heart transplantation. Here you see a diagram of a VAD, and what you can see is this VAD here is able to take blood out of the left ventricle and pump it directly into the aorta. Let's discuss medications for angina pectoris. Many of these medications you will have seen already. The principal symptom of angina is due to an impaired oxygen delivery to the heart because of occlusion of coronary arteries. Certain patients will also have spasm of the smooth muscle in the coronary arteries. This is referred to as Prinzmetal's or variant angina. These patients do not necessarily have coronary artery atherosclerosis. There are 3 major classes of anti-anginal agents that we'll talk about, and they include nitrates, calcium channel blockers, and beta blockers. The goal of the treatment for anti-anginal medications is to decrease vasospasm in the coronary arteries, as well as decreasing the oxygen requirement for the cardiac myocytes. Nitrates, as we talked about before, are converted to nitric oxide in the body. Nitric oxide activates guanylyl cyclase, which increases cyclic GMP production. These medications include nitroglycerin and Imdur, or isosorbide mononitrate or dinitrate. These medications can be given orally, sublingually, intravenously, transdermally. Because nitrates work very well at dilating smooth muscle, they can have a diminished response over repeated use. The main limitation to nitrate therapy is tachyphylaxis, or basically a tolerance to nitrates. It's very important that patients that are taking nitrates do not take them at night. A rest period of 12 hours or more without nitrates can restore the effectiveness of nitrates to the full value. The adverse effects of nitrates include excessive vasodilation, which can cause flushing, migraine headache, orthostatic hypotension, and syncope. They can also cause reflex tachycardia and fluid retention. It's well known that patients that are taking sildenafil, also known as Viagra, as well as other medications along with nitrates, can develop sudden deaths related to excessive hypotension. Patients that are taking nitrates should avoid using Viagra. Viagra should also be avoided in patients that have hereditary retinal diseases because Viagra has been shown to cause blue-green color vision blindness. Many patients that have angina pectoris will eventually require angioplasty because their coronary disease has gotten so severe they will require a stent being placed in their coronary arteries to open up the coronary and allow blood to reflow. Here are some examples of balloons and stents that can be inserted into the heart through catheters. This concludes our section on medications given to patients who had heart failure as well as chest pain. In our next section, we will go over anti-hyperlipidemic medications, or medications given for high cholesterol, as well as going over some cardiovascular vignettes.